Right, World AIDS Day was marked yesterday, a day designated to observe, celebrate and take stock of the efforts made in the HIV/AIDS awareness and education. Observed under the theme, Let Communities Lead, this year's statistics have shown that women continue to be the collateral where the stats lie. The AIDS Healthcare Foundation observed the day in Kwamashu, speaking to the grassroots efforts and work done by the organization. We speak now to the AIDS Healthcare Foundation National Prevention Manager in South Africa, Tusani Kunene. A very good morning to you. Thank you so much for your time. Of course, really, grassroots programs for communities are essential in ensuring that the message continues to be spread around curbing the numbers and getting people on treatment. Talk to us about, what comes to the forefront as we observed and commemorated World AIDS Day yesterday.
Thanks, Mpho, and good morning to your viewers. Yes, today we had a commemorative event at Kwamashu and the surrounding areas, which is in Durban and KwaZulu-Natal. It was a platform to raise awareness about the epidemic, honor all those who have lost their lives to HIV-related illness, support those who can carry on the fight, and unite people globally in battling HIV and AIDS. We know that the people living with HIV are at the heart of what we do. While we're celebrating the day with a diverse group of people to make up this community of Kwamashu and celebrate the HIV allies who stand shoulder to shoulder with them and fight for HIV rights, while celebrating the milestones that we have been able to achieve as a country over the years. While the world has made significant strides in the progress against HIV and AIDS over the past decades, but we know that globally the response to face serious threats, including insufficient funding, generously higher rates of about 1.3 million people of new HIV transmission annually, and an estimated about 630,000 deaths each year. And the response is not being prioritized highly enough, and particularly in lower income countries. To give significant meaning, South African team, that is the World AIDS Day, Let Communities Lead, we are hosting commemorative events in the different areas of South Africa, including the Eastern Cape, Gauteng, and KZN as well also.
As you speak about new HIV transmissions annually and take stock of that number, we do know that when it comes to the province of KwaZulu-Natal, it has the highest prevalence in South Africa, really looking at the rate at which transmission happens. I mean, approximately over 1,000 young people in KZN are contracting the virus every week, really speaking to a desperate need for education when it comes to HIV. How are you faring in that space?
Well, of course, the recent results from the Human Research Council are showing that the infection rates amongst our young people are almost twice as much in relation to their peers. But we know we have got different programs that are currently existing, like your PrEP, which is your pre-exposure prophylaxis, whereby people can be able to take medication to prevent HIV and AIDS. And we have a groundbreaking vaccine development which continues as well also to try and cap the infection rates amongst the young people. But continuously, what we're trying to do is to engage young people around behavioral studies as well also, whereby we have to implement more programs which are more focused on young people, in terms of making sure that we focus more our efforts in reaching out to the young people, because this is where the infection rates are quite high. And so our programming, as we move forward towards 2030, whereby we're trying to end AIDS, we make sure that we work towards that, but at the forefront, we have to work mostly with young people.
Yeah. What have you found when it comes to the smaller rural communities, perhaps, some of the challenges? Have you found that access to the drugs may be a factor when one has to consider whether or not to continue treatment? Has that been, a deterrent for some people who are saying that they cannot access the drugs because of distance or because of underdevelopment in their rural communities?
Yeah, of course, and in rural communities, when we understand and the issue of distance and whatnot is still a problem, and in terms of accessing any healthcare services. But the government has made significant strides in making sure that anyone and everyone who's within the communities and is able to access services. We have youth-friendly services and that are actually being established within the healthcare settings. We have men's clinics that are being established as well, within the healthcare settings to try to make sure people are able to access healthcare services in a manner that is more accessible. But of course, there is still any issues or problem in terms of access because stigma still remains with us when it comes to addressing issues that surround HIV and AIDS, and hence you find that some of the people might be deterred from accessing healthcare services at an earlier stage and rather than late.
And that access, when we have to now break it down in demographics, a lot of the studies are showing that women are more likely to know about their status and get treatment as opposed to men. Where are the big challenges with men?
The problem with men and what we've discovered in terms of even the studies are showing that men are the late presenters and when it comes to health related matters and the health seeking behaviors. So we still have to do a lot of education amongst men in terms of accessing healthcare services earlier and presenting to the healthcare facilities and making sure that they test for their status and at an earlier stage, and rather than presenting late and when they are already infected and at an advanced stage of HIV and AIDS. So those are the critical issues and that's we're finding, and hence and in terms of programming and as I highlighted earlier, that's the focus and it has to be more around men and including young people in making sure that we reach those particular groups because in terms of the spread of HIV and AIDS, this is where we are still lacking as a country.
We heard Deputy President Kwamashu saying that the HIV treatment gap between the general population and the children is of concern, and he spoke about the cohort of 15 years and below being left behind. What's your take on that space as we take stock of some of the big changes that are needed to ensure that there is indeed a reduction in the number of people becoming infected?
I think in South Africa particularly, what we find is that it's like the infection rates whereby you find that your infection rates between your 15 to 24 is twice as compared to their peers. So we have this problem whereby young people are having relationships with older people because of socioeconomic issues, and that creates a problem in terms of fighting the spread of HIV and AIDS. So meaning we have older men who are having relationships with younger women, not particularly because younger women are having relationships with their own peers. And so that creates a problem for us, and in terms of making sure that when we address these issues, we focus on both these particular groups in addressing the issues related to HIV and AIDS. Otherwise, it's going to be difficult for us to reduce the number of new HIV infections. Of course, there is a significant stride that have been made over the years between 2017 and 2022, whereby we have been able to reduce the number of infections from 14% in 2017 to 12.7% in 2022. But a lot more still needs to be done, and hence the reason why we have the team that communities lead, in which whereby we're trying to make sure that communities and people within our own communities lead the way in the fight against HIV and AIDS.
Yeah, absolutely. And very lastly, before we let you go, what are the general perceptions do you find when it comes to how people are feeling about HIV? Is it still a disease that's feared, or is there a reduction of stigmatization? Where are we standing as communities?
Well, people, in terms of acceptance, South Africa has made significant strides, and in terms of trying to address those particular issues, and in terms of your status and acceptance and whatnot. But of course, we still have issues in certain communities and around stigma, where people who are HIV infected and are still stigmatized. We still have issues of GBV, gender-based violence, whereby it's an intersection around HIV and AIDS, and it prevents women to make informed decisions about their own health. So those particular issues put together sometimes make it difficult for people to make informed choices when it comes to their own health and lifestyle, in making sure that they make the right choices around their lives and HIV and AIDS.
Very well. Thank you so much for your time. Of course, that was AIDS Healthcare Foundation National Prevention Manager in South Africa, Tusani Kunene, speaking to us about commemorating World AIDS Day. Now,